New Brunswick has launched a self-referral line for people seeking abortions in the province. They issued a press release about it, but we wanted to know, what is it actually like to call?
Hello, bonjour, in the abortion line.
Hi there. I'm just calling with some questions that I'm wondering if it would be okay to ask.
Yeah.
Advocates say New Brunswick is only the second province in Canada to launch a line like this one after Nova Scotia, and they've been working toward it with the government for the past 3 years.
There's new staff working at the Moncton City Hospital who will answer the phone or take the message if you leave a message. So they'll walk through your options, procedural or medication abortion, determine whether you can get what you need really close to home, whether you need some telemedicine, whether you're going to come in person, and book you. So it's one phone call. And that will really, we hope, make things easier for patients.
The province says the new service is meant to make abortion more accessible no matter where you live in the province, what language you speak, or whether you have a family doctor.
As you can appreciate, this is a service that needs to be available sooner than later. And so we felt there was a gap in access to service. And this is a strong part of what we are trying to do in this province, is to make care more accessible. So we felt that by establishing a 1-800 number that's quite public, available to everybody in this province, that people would get the care they need, when they need it, where they need it.
So what is it like to call the line? We thought we'd give it a try. Often when journalists record a phone call, they're upfront about that and identify themselves. In this case, we wanted a genuine experience, so we withheld that information and only notified the department and health authority afterward. We started the call by saying, "I'm just calling with some questions. I'm wondering if it would be okay to ask," and asked process and access related questions throughout the call. The woman who answered the phone began by explaining my options based on location.
So we can find the closest place. Like if you live in Fredericton, I have a spot in Fredericton. St. John, they do MA, that means the medication by mouth. But if you want a surgical, there's only George Dumont, the Moncton Hospital, and Bathurst.
I asked her about risks and complications. She said a woman seeking an abortion has any and all risks explained ahead of time during a consultation appointment, and that a person can change their mind at any point.
If you go at the first appointment and afterwards you decide that you don't want to go through this, you can always say no there.
Without a valid New Brunswick Medicare card, someone seeking an abortion might have to pay out of pocket, and staff said they work to book timely consult appointments. And what are your guys' wait times like? What's the earliest that you could get someone in for an appointment if they were booking today?
So if you want, for us, the first appointment that I can give you for a phone call, I have a spot on Monday at 9:30, or I have Tuesday afternoon, Wednesday morning, Thursday afternoon. After that, depending what you decide, usually within 2 weeks you can have the appointment.
What information would you need from me if I were to be booking an appointment?
It's more the Medicare, if you have the Medicare, and the expiry date. The rest is just when was your last period, the first day of your last period, or
Okay.
the normal, and then your address, your telephone number, just the main thing.
Abortion access hasn't always been a single phone call in New Brunswick. Up until 2015, to be covered by provincial Medicare, New Brunswickers needed 2 referrals from doctors who said it was medically necessary.
Government will be moving forward with an amendment to 8420 to no longer require 2 physicians to certify that the procedure is medically required, and to remove the requirement that the procedure must be performed by a specialist.
And since Clinic 554 in Fredericton closed in 2024, hospitals in Moncton and Bathurst are the only places a person can receive a procedural abortion. Painter says there's more work to be done, but she's glad to see new access resources.
What really remains the most challenging aspect of abortion care for New Brunswickers is knowing how to get one. There's, been so much change, especially in the past 11 years, and it's hard to keep up with all those very positive changes. And so we want the public to be aware of those and to have really easy, really quick access to care.
The Department of Health committed just under $200,000 to staff the phone line.